Patino here at the Cosmetic Surgical Center of El Cerrito. We're going to do what is called micro-air, power-assisted liposuction to the inner thighs. And then we're going to turn it to the back and do the back side in a Brazilian butt lift under ultrasound to keep this procedure safe. And we're also going to do Carboxy Pneumo Dissection. And you're going to be the first ones to see what comes out of here, right? So this is the inner thighs right here. And notice how we go very slowly here, you know, and let's see what comes out, you know. Look at this, it's already, I can already see yellow, beautiful fat, and that's the fat that we're gonna put into her buttocks, right? We do this in a very gentle manner. You see, look at the quality of the output. Wow. It's just pristine, right? Not a single drop of blood here at the Cosmetic Surgical Center, and that's the way we want to do this, because what we're gonna put into her. Robert, so you've been an anesthesia provider for how long?
About 20 years now.
20 years, and you've done plenty of liposuction, right?
Yes, I have, sir.
And have you ever seen an aspirate like this?
It's unusual to see it without blood, yes.
It's pretty yellow and beautiful.
Yes.
Normally, what color is it normally when you go with all the doctors and stuff?
It would be red color.
Red, and this is pretty yellow and beautiful, huh? Thank you. What is it you're saying, Robert?
I haven't seen the power
Yeah, but it's not just a tool, because a lot of doctors, they have the same tool. It's like a toothbrush that's electric, right? But a lot of doctors, they just keep jamming it in because you'll do it faster. But this yellow aspirate is pretty unusual, right? So this is what's gonna go into her buttocks. And it's very common for us, but what I'm saying is unusual for most people that do these. Usually there is blood, but you can see not a drop of blood here when we do this here at the Cosmetic Surgical Center of El Cerrito. And it has nothing to do with the power tool. It has to do with the tumescent anesthesia and the fact that we waited a good hour before we even started. So we're not in a rush here. We just want to do a very, very good job in a bloodless manner, because this fat that's going to go is going to go right into her buttocks, right? We don't want to put blood in there. Can you see the river of yellow, beautiful fat, Astrid?
Yes.
And
solid gold.
yeah, that's what's going to go into her buttocks, you know, this yellow, beautiful fat, you know. That's what we're very, very careful, and we go slowly. Look at that, you know. We still can get a lot of these goodies, you know. It's very nice, yeah, beautiful. You see that? I don't know if you can see that. Can you see that?
Yep.
All that beautiful aspirate, right?
Wow.
Yeah. Incredible. This is just from the inner thighs, you know. So now that we collected all the fat for the fat transfer, we're doing laser-assisted lipolysis for maximum skin tightening, less bruising, less bleeding, and a faster recovery. Thank you. Okay, so this is the Carboxy Pneumo Dissection here at the Cosmetic Surgical Center of El Cerrito. We're putting CO2 into the buttocks to keep this procedure safe, to move the subcutaneous tissue away from the muscle, expand the subcutaneous space, and to bring more oxygen to the tissues. Thank you. Okay, so this is ultrasound gluteal fat transfer here at the Cosmetic Surgical Center of El Cerrito. See that bright structure you see there? That's the ultrasound. So we're going in the right place above the muscle. You see that bright structure right there?
Wow, yes.
That's the cannula. Beautiful, you see? Thank you. Wow, and look at the quality of that fat. I mean, that is incredible. Look at that.
Wow.
Yellow, beautiful fat. It's just beautiful. Thank you. Wow, so what were you saying, Robert?
That's as good a fat as I've ever seen.
Yeah, right? And this is the first time you see a fat transfer with us, right?
That's correct.
But you've been doing this for how many years?
20 years.
20 years, and you've never seen beautiful fat like this, huh?
Mm-hmm.
It's yellow without a speck of blood.
That's
incredible. Correct. Thank you.